If you're connected with our office here at Tompkins Family Chiropractic, you probably are looking for natural ways to be healthy, natural ways to feel better, natural, non invasive ways to get your body functioning as well as you possibly can. And so today I'm here with my favorite acupuncturist, Nicole Rasor. She's here to demonstrate some of the things that happen during an acupuncture session so that you can know how acupuncture can help someone like you. Nicole, welcome. Thank
Thank
you.
you. Thanks
Thank,
for having me.
thank you for coming here. I really appreciate this. Tell us a little bit about what you do in your practice.
So, I'm a traditional Chinese medicine practitioner. I am a licensed, nationally board certified acupuncturist and also herbalist, which is not a given in Arizona. You don't
Yeah.
have to study herbs to study acupuncture.
Mm,
But I went back to school after I finished my acupuncture degree and also took me about 4 years to finish the herb degree. And both of these are masters. That's what you have to have in order to be a licensed acupuncturist. And then in a few years back, I went back to school to get a doctorate in acupuncture and Chinese medicine.
wow. So
Yeah.
how much schooling do you have to have, or how much schooling did you have to get to
I
where you?
had a total of 10 years.
Wow, that's amazing.
Yeah.
That's amazing.
So you can do it in 3 or 4 if you combine acupuncture with herbs. I
Mhm.
split it. So I was already practicing when I went back to get my herbs. So you don't have to do it sequentially. You can do it at the same time.
That's really great. And you have an office, it's called Active Life Acupuncture.
Active Live Acupuncture in Oro Valley. It's between McGee and Suffolk Drive on the east side of the street.
Very cool. So that's just right off of, yeah, Oracle and that McGee area there.
Yeah.
That's really good. So it's in a really good, convenient location on our northwest side. And I'm very thankful to be able to send patients your way. So now people have questions, I'm sure, as far as acupuncture. We know are needles that are involved, or maybe there are needles that are involved. Do you want to tell us about what it is that you use?
We use sterile stainless steel needles. They are very thin. I can take one. They are a tiny bit thicker than a human hair, but they're thinner than a cat's whisker. And I use about 2 or 3 different lengths and 2 different gauges. So this one is the thinnest one I use. And then when I do electrostimulation on our model here, I will use a little thicker needle.
Mm, that's fantastic. All right. And you have a great model here.
Yes. Um, this is Caleb. He volunteered today to be my model. Before we started the recording, I already did an intake with him, so I know what his ailments are. He complained of pulling his back right here in the QL area during weightlifting a couple days ago. And he has a chronic pain in his traps right here and in his neck from
Wow.
work that he does daily. He's also got very tight hamstrings and he complained of some digestive disorders. So we will address all that. Traditional Chinese medicine is a full body approach. So I am treating his complaints such as musculoskeletal, but also digestive, or if he has sleep issues or anything systemic as well.
That's really interesting. So now you've mentioned a couple of different things, and maybe we'll just get into this a little bit deeper before you get started. You mentioned some of the musculoskeletal, the things going on in his back that you're going to be working on, but there's a lot of other things that you take care of or that acupuncture
Yes.
can help people with. You started talking about it, but can we go a little deeper into that?
Yes. So traditional Chinese medicine uses, I'm going to use my little acuman here, um, acupuncture points that are placed on meridians. There are 12 meridians. Uh, they are somewhere under the skin. Nobody really knows exactly where they are. The latest theory is that they run in the interstitium, which is fascia area. These meridians have several acupuncture points on them, to be exact, 360 some. And on these acupuncture points is where we can access these meridians easiest. Now, even though we have all these acupuncture points, there might be some pain points that Caleb has that are not on an acupuncture point. That is not a problem. They're called pain points, and we can treat those as well. But there's a good chance that most of the things that I treat will hit an acupuncture point.
That's really
And these meridians treat various ailments that are related to any of the organs in our bodies.
Now, I'm sorry, and I apologize if I missed it, but you mentioned meridians a couple of times.
Mhm.
What specifically is a meridian?
So a meridian is a energetic highway or energetic river, if you picture these lines to be rivers.
Okay.
So if there is no free flow of that water in the river and it dams up or clumps up, that creates pain or it creates inconsistencies in any system, sleep, neurological, endocrine, what have you. And the goal is to unblock these areas so everything has free flow.
Nice.
So that's our goal, is free flow of energy from top to bottom.
All right. Great. Thank you. Okay. So, what are we treating today?
So Caleb, like I mentioned before, complained of back pain, neck pain, tight hamstrings, and loose stools. I already made a treatment plan before we started the recording here, so that's all written down. I already washed my hands. I'm still going to alcohol them one more time. I've written down my acupuncture points, so that's already done too. And now I'm going to swab. This is alcohol. I'm going to swab the areas that I'm going to needle with alcohol just to get rid of some surface dirt, which he's not dirty. He's very clean. On the legs, I will be treating some systemic points. I always like to treat the digestion and I always like to treat stress. And then there's points like this point right here that also treats back pain. And the reason why this treats back pain is because it is on the same meridian as where his actual pain is. So we like to treat also distally from the actual pain area. Or proximate, you can go up or down. So I cleaned him up. I will use 2 different types of needles. I use thinner ones in the neck area. And then I will use thicker ones where I'm actually going to do a little more modern technique on his low back, which is electrostimulation. I already made sure that he's a good candidate for it. Not everybody can use electrostimulation. For example, if you have a metal rod in your back, I would not be able to use that. Even though titanium is not magnetic, it can still conduct electricity. So I do not want to shoot electricity through the metal rod in your spine. So Caleb, I've started to put needles in. The feelings that I want you to have is achiness, tingling, something you can't describe, warmth. If it's a sharp nerve pain, like I'm hitting a nerve, please let me know. I'll remove the needle. It should not be painful. I also like to go on the side of the spine. There's little muscles there. There's little facet joints. We know our bodies are incredible. They can heal themselves. They just need to be a little encouraged, like relaxing the muscles around certain areas. So for example, the vertebrae, if it's a little moved, it can go back to where it needs to go, or the disc can go back to where it needs to go. And if it doesn't, then I send them to Dr. Tompkins.
Thank you for that.
Sure. Depending on the area, the depth of the needle depends on the area. Up here are the tips of the lungs. We go a little bit in an angle, and that way we can go a little deeper, but we do not want to go very deep straight in because we do not want to hurt the lungs and cause a pneumothorax, which is pretty much popping off the lung. How you feeling, Caleb?
Oh, great. I definitely had some tingliness when the needle landed around my neck. Overall,
No pain?
pain.
Great.
So, in general, we shouldn't be expecting any amounts of pain at all when we're doing this.
No, if you feel achiness, that's great. If you can see, there is some redness around the needles right here. He's releasing some heat there.
Yeah.
So now I'm using a little thicker needles in his QL area. I'm gonna go a little deeper. So I went about an inch or so in there, maybe 3/4 of an inch. So they have to hold the clips of the electric cord, so it needs to be. So this is where the kidneys are. So the ones that are higher up higher up here, I'm going to put more in an angle. The lower one can pretty much go straight in. I still did it in an angle, but anything L2 and higher needs to go in an angle. So now I'm going to add, I always like to do a little bit around lumbar 4 and 5. Create some relaxation in those spaces. Pretty tight there too. That went in a little easier than the one below. So you see me tapping. This needle, I use a guide tube. The needles are a tad bit longer than the guide tube, so I can quickly get the needle through the skin, which makes it less painful. I also like to go a little bit in the sacrum. Ticklish or pain?
Ticklish, yeah.
Okay. He was flinching, so I want to make sure I didn't hit something that hurt. Just working my way down.
When you see all those needles, it's hard to imagine that there's not pain associated with it, but it's pretty fantastic that you can do it and it's not painful.
Right. It also takes some practice. I've been doing it for 17 years, so I'm sure I caused more pain in the beginning of my career. So now I'm going to use that point that's also for low back pain. It's in the belly of the calf. There's more than one, but this is the one I'm going to use. And then I'm going to do some systemic points that are purely Chinese medicine. Like this point right here, it nourishes the energy of our blood. Let's see. I use these. Now I'm going to go on the outside of his lower leg. And this is a big one. That one works on stress. And it's also the command point of tendons, which his tendons are really tight. So I'm going a little deeper. His muscles were really tight, so they were fighting my needles a little bit. So I just put the needles in just a little bit, and now I can't, once it's relaxed, I was able to push them in a little more to get a little deeper. Same with the hamstrings. They just, oh, see, now they're sliding in easily.
And they're going in easier because after a period of time that the needles are in there, those
The muscles
begin to
relax.
relax.
Yeah. Yeah. So I don't force it. If his muscles won't let me, I just let him sit a bit and then it lets me go in. All right. Those are all the needles I want to do. Let's see if these are nice in there. Many people also use heat lamps. I didn't bring that today. An infrared heat lamp. I like to use topicals. For Caleb today, I'm going to use an electrostimulation machine on his QLs. They look like little jumper cables for a car. I hook them right, and you never cross the spine. You go one lead on one side and the other lead on the other side. Now, Caleb has never had electrostimulation, so this is new for him.
I can see the electrodes connected right to those needles. That is so interesting.
Ticklish?
Yeah, I'm very
sorry. Okay. There we go. Make sure they rest here. All right. Now I'm gonna with the green lead. I can do up to 3 leads on this machine. All right, I'm going to start on the left. What I want you to feel is pulsating. It'll be on one or the other needle, but it's like a little ticking feeling. As soon as you feel that, you let me know. I'm going to go slow. Should start feeling it soon. You feel it? Just a little bit? Okay, now we're going to do the other side. You should feel it.
Yeah,
Got it? Okay, that's all we're going to do. Just a little extra. I use electrostimulation when people have a fresh injury, if it's not contraindicated. And if it's a stubborn condition, then sometimes I use it too.
And what are you expecting to accomplish with the electric stimulation?
More blood flow, breaking up some of these tight, stagnant muscles, and healing faster.
Good.
Yeah, it's very anti-inflammatory too.
That's fantastic.
Yeah, so the needles stay in for 30 minutes.
Okay.
And patient rests. Most people fall asleep.
Nice.
And then after 30 minutes, I come back in and take the needles out, and patient is ready to go.
That's great. And it still feels good, Caleb.
Yes.
All right.
Are you relaxed? What are you feeling on all the areas?
Very relaxed. Very slowly, my muscles are relaxing as well.
Great.
When you're working with someone, what does a treatment plan look like?
Over the 17 years, I learned that when somebody has, especially most people come to with a chronic condition, unless they're already patients and know that when something is fresh, it's easier to treat. But most people come and it's usually a last resort. So it's usually a condition that's been around for a while. So what I ask people to do is to schedule 6 appointments really close together. I like to do, and I book them right away because I work part-time and I want to make sure I have room in the schedule for them. So I book the first 6, 2 to 5 days apart. And most people start getting relief in those first 6. And then the following treatments, we spread them out more and see if the pain relief stays.
Good.
Yeah.
Very good.
So it's not a 1-time, 2-time deal, just like chiropractic. A condition.
Well, just like anything healthy that we do, we tend to take a long time to get to the position that we're in. And so it can be a process of getting us back to normal, even though it hopefully you improve a whole lot quicker than we got ourselves into this
Mhm.
condition in the first place, which is nice. So you'll come up with a treatment protocol of 6 visits initially, and then based on how
How they
they
do. If
respond.
they get no response, I very often suggest to add another modality like chiropractic, massage, PT.
Okay.
Yeah, so I do that often.
And then you had mentioned that you have a lot of certifications with herbs.
Mhm.
Is there anything that you'll do with that with someone in your office?
Yeah, I order herbs for them.
Mm.
I determine the most I use herbs with is systemic things like women's health, hot flashes,
Oh,
endocrine things also. And I usually work with their physician with that. Like I want them to be aware that I'm doing that because sometimes we have to navigate other medications and that can get tricky with herb drug interactions. So I want their physicians to be aware that what we're doing.
that's good. It's good that you're aware of that and you pay attention to those interactions that the herbs can have with other things, whether it's other supplements, other medications, some of the things that those patients are taking. At your office, do you take health insurance?
So I do not contract with any health insurance carriers. However, if your insurance covers acupuncture, I will give you a receipt with the codes and you can self-submit. And most people, it will probably go towards their out-of-network deductible.
Oh, okay.
Yeah.
All right.
And however, that does not apply to Medicare. Medicare allows acupuncture for low back pain. However, independent acupuncturists are not recognized Medicare providers yet.
Interesting.
So that is a bipartisan bill in front of Congress right now. And it's probably going to take another couple years
Wow.
before that is approved. In the meantime, independent acupuncturists cannot bill for Medicare. You
Okay.
have to work for a medical doctor
Interesting.
or bill through them, but
Mm.
quite frankly, I don't know anybody who does that.
Yeah.
Yeah.
That sounds like something that would be very uncommon. But
Yeah.
if you have insurance, if someone has insurance, they can see you, they can pay for their care. You would give them some kind of receipt or
With
super
the
bill
ICD
that
codes.
has all the
Yeah.
things that they
Yeah.
need to send to their insurance. And if their insurance covers, they potentially will have some
And then
kind of
they
coverage.
reimburse the
Yeah.
patient directly.
Great. Okay.
Yeah.
All right. That sounds really simple enough. So if you have insurance, you definitely can still see
Yeah.
Nicole.
You
Great.
may not get reimbursed, but
Yeah,
it
depending on the
depends.
coverage. Okay.
Yep.
Great. Awesome. Thank you. Okay. Um, is there any interesting news, or this may be a weird question, but controversy or something wild surrounding acupuncture that we want to talk about?
The only controversial
there's-
thing is the dry needling versus acupuncture.
Oh,
Yeah.
actually, that's really interesting because people go to plenty of places, physical
Yeah.
therapists, other places
So
to get dry needling. What is the difference between dry needling and acupuncture?
So the difference, there's several differences. First of all, it's the name. And the reason why mostly physical therapists do dry needling.
Mhm.
The reason why they are calling it dry needling is because they do not have the amount of training that is required to be an acupuncturist and call it acupuncture. That's one difference. So I think physical therapists have to have 25 patient hours of practice.
Mhm.
We have 800 to 1200, depending on if you're doing herbs and acupuncture at the same time. So that's one difference.
Mhm.
The other difference is the whole traditional Chinese medicine system. Yes, we go, like you saw in treating Caleb, I do go into the sore muscles and activate trigger points and go locally, but I also do Chinese medicine points to treat the whole person.
Oh,
So that isn't the other major difference.
yeah, you definitely wouldn't be getting that
Yeah.
with dry needling.
No.
Well, and
And they only treat one body part at a time. So I treat everything that I can get to
Yeah.
at the same time as the main complaint.
Yeah.
So Caleb's main complaint was his low back. I was able to treat his neck and his hamstrings and his digestion all at the same time.
it sounds like a difference between simply taking care of a symptom
Hmm.
and placing a needle in an area of a symptom, or taking care of the whole body, making sure that we do things to make sure that your whole body is balanced while helping with the symptom, which is what you want to do. And it seems
Exactly.
to me like that would be more valuable.
Yeah. There's dry needling works
Mhm.
if you took the time to have good training, and that's really the major thing.
Yeah.
Do you have enough training to do it properly?
Yeah. And it seems in my very limited experience with dry needling, it hurts a lot more than acupuncture does. So
Yeah.
I would.
And I think that's where the needling technique comes in.
Mm,
Yeah, people think acupuncturists don't go very deep. We do.
mhm.
We do if it's beneficial.
Yeah.
We do.
But you know how to do it in a way
Yes,
that's
there is
helpful,
no need to dig
and
for it.
not hurting.
Exactly.
Yeah,
And anything you do 1,000 times more, you're going to be better at.
that's right.
Yeah.
Even a chiropractor can get licensed for acupuncture here in the state of Arizona. And I've had people ask me, they'd say, could you do acupuncture? Or can you do acupuncture? And I tell them, for one, I'm busy enough being a chiropractor.
Mhm.
And so why would you want me to learn how to do acupuncture in my limited time and experience to do that than see someone who that is what they do? That is their specialty, that they've done the hundreds and thousands of hours to be able
Mhm.
to achieve that than someone who maybe had a few hours of training and certification to be able to do it. It's infinitely more valuable, I think, to get acupuncture from an acupuncturist. So
Agreed.
I'm very, very, very happy to send people your direction. So
Thank you.
thank you. Thank you very much. This is fantastic. What else should someone know if if someone that watches this video decides they want to see you, how do they go about making that happen?
They call me or they text me.
That's
That's
great.
the best way.
Okay. What's a good number to reach you?
It's 520-548-1838. It's my cell phone. It's also my business phone. Texting is great. Yeah,
That's
I
great.
prefer that over email or
That's great. I know plenty of people that we take care of that could definitely benefit from the things that you are offering. So I'm glad that we're able to do this. I'm glad we're able to get your information, your message out to people that will have the opportunity to experience it. And I encourage anyone that's interested in acupuncture to definitely give Nicole Rasor a call and schedule a time with her. She really is fantastic.
thank you.
You're welcome. Is there anything else that the audience should know before we end here?
Acupuncture is very much non-invasive.
Mhm.
So if you are on a bubble of whether you need to get surgery or you're not sure you want to get surgery, while you go on that path, we can still work on you and see if we can get it better and maybe not have to go that route.
Okay.
Also, if you are to the point where you need to, for example, a cortisone injection, what I like to do is treat people right after, about a few days after their cortisone injections, and get on a regular schedule. So hopefully they don't have to have another one in the future.
That's good.
So that's been working really well too.
So with acupuncture, you potentially can prevent people from needing a cortisone injection or from needing multiple
Future,
injections.
yeah, or spread it out longer.
Yeah.
Yeah, I have a few patients that have bone-on-bone knees and they haven't had one in 2 years,
Okay.
but they come regularly.
Mhm.
What I try to do is try to spread out your treatments as much as I can or as much as your body allows.
Yeah.
So most people that have a chronic condition come about monthly.
Okay.
Yeah.
Okay. That's great. Well, it sounds like you have a really good program going, a really good system that you have. And it looks like our model here is really enjoying it. Good. All right. Thank you
Thank you.
very much.
Thank you.
And for anyone interested in acupuncture, you know now how to get a hold of Nicole. She is fantastic. Our patients know her and love her, and you'll be in good hands. Thank you.
Thank you.